Good afternoon. Thanks for joining us Across the Fence. I'm Fran Stoddard. In the past year, an estimated 4,300 Vermonters were diagnosed with a type of cancer. Approximately 1/3 of those diagnosed, or about 1,500 Vermonters, will die of it. The good news is that enormous gains have been made in cancer survivorship, and those gains have come from research, treatment, and education. The University of Vermont Cancer Center is the state's only non-for-profit comprehensive clinical and research center. Since its founding in 1974, the center has been improving and extending the lives of cancer patients by providing critical research, clinical treatments, and community outreach. To learn more, we're joined this afternoon by Dr. Randall Holcomb, who is the director of UVM Cancer Center. Welcome, and thank you so much for being with us.
Fran, so happy to be here.
So why don't you just ground us in what is the Cancer Center?
Well, Cancer Center is actually many things. We do have a mission of education. We're, of course, here at the University of Vermont, so we're interested in training a new generation of cancer scientists and cancer clinicians. We also have a big mission on community outreach and engagement. We want to know and understand what the cancer issues are in the community and make sure that we address those issues as best we can. We're a clinical care facility as well, working with the University of Vermont Medical Center, and that includes clinical trials, which bring the most novel cutting-edge therapies to patients. And then finally, we're a research entity. We do basic laboratory research to try to understand the mechanisms of cancer so that we can develop new treatments for the future, and also population-based research that focus on things like screening and prevention.
Terrific. And, I just read that 64% of Vermont women who should be getting mammograms are indeed getting mammograms, but that 36%, or almost a third, one out of 3 Vermont women, are not getting mammograms as recommended. How do we get more people to get mammograms?
Well, that's a difficult problem. 64% is not terrible, but it's actually below the national average. So we would like it to be better, because if we find breast cancer early, we can cure breast cancer. We do have a big research program that Dr. Brian Sprague runs related to understanding why some people don't get mammograms and to improve our screening rates. It's also important to understand that sometimes men get breast cancer as well. And in fact, we are working with the Vermont Pride organization, who have a great screening program called Got 'em, Screen 'em. And that's really for both men and women. And addresses breast cancer in really one of our critical communities here in Vermont.
Great. So if breast cancer is detected early, what is the rate of survivorship?
Well, if we detect it at stage 1, the rate of survivorship is over 95%. So we can cure most breast cancers when they occur early. There are some difficult forms of breast cancer. People have heard about those, such as the triple negative breast cancer. Those are more difficult to treat and have more of a propensity to relapse. That's where we really need to do more research to find new treatments. We have gotten many new breast cancer treatments over the last several years, and that has really helped to improve survival for women at all stages when it's discovered.
Terrific. So early detection of breast cancer is certainly critical. What about other types of cancer? How is early detection there? How is it possible, and what does it do?
Well, we have a few other cancers that we can do early detection with. Prostate cancer, we can do some screening through a blood test called the PSA test. Colon cancer, of course, requires colonoscopy, but there are some newer ways to test for colon cancer in average risk individuals that involve sampling the stool for DNA changes that may occur with cancer. And then lung cancer is also something that we can screen for with something called a low-dose CT scan. And that's especially important for people who are smokers and have been smoking for a long time.
So lung cancer rates in Vermont have dropped, but lung cancer is still the #1 cancer killer in Vermont. So how well do these screenings work, and tell us about the screening that you do have, the CT, and when do people go in? How do they know?
Well, they should talk to their primary care physician about screening. I think that's probably the most important. Lung cancer is the leading cause of cancer death here in Vermont, and we need to do a better job at screening. It's not one of the screening tests that people think about. And so if someone is a smoker, they've been smoking for a long time, say 20 years or so, they should definitely talk to their primary care physician about whether screening for lung cancer is advantageous. I think that we would like to see increased rates, and we are working across the state and also with some cooperative programs with Dartmouth as well to increase lung cancer screening in northern New England.
Terrific. So we've made advancements certainly in many types of cancer screening, and we've lowered rates for many types of the mortality rates for many types of cancer. But have we learned more about what causes cancers?
We have learned a tremendous amount about what causes cancer. We know that cancer is not a single disease, there's multiple different diseases. And in fact, we used to think of lung cancer as a single disease or just two diseases, and it's not. It's probably about 15 or 20 different diseases, depending upon which genes are actually driving the malignant transformation. So we have learned a lot, and that has enabled us to develop what are called targeted therapies so that we can target the specific pathway within the cell that's activated by a genetic mutation and try to address the cancer from that perspective, as opposed to just using traditional chemotherapy. Often these targeted therapies are most effective when we combine them with traditional chemotherapies. And the targeted therapies tend to have overall less side effects than traditional chemotherapy. So this has really been a great advance.
That's terrific. Well, and if you're joining us, we are talking to Dr. Randall Holcomb, who is the director of the UVM Cancer Center. So how important would you say lifestyle issues are in terms of cancer prevention? Of course, you mentioned smoking.
Smoking is, of course, a big factor and the leading cause of preventable cancer death. So we do have some smoking cessation programs to try to help people to stop smoking. That's a difficult task sometimes, but it's very important. There are other lifestyle factors which are also important. We know that people who exercise and who are less overweight have a lower risk of cancer. And so this is something that's important also. We need to address nutrition, exercise, obesity, which is a problem really across the country and has been an increasing problem. And I think that that's an important factor related to cancer prevention as well.
Great. And what about familial cancer, hereditary cancers? Do we know why these happen, and can we find out about them early to prevent cancers?
We certainly can. We actually have a familial cancer program here at the University of Vermont Cancer Center where we do extensive genetic testing and can try to identify whether there are specific genes that are transmitted within families that may be causing cancer in an individual and an increased risk of cancer for other members of the family. We know a lot about these genetic syndromes because of laboratory research that's been done over the last 20 to 25 years. And we can address some of the risk that is associated with these familial syndromes by earlier screening and by specific prevention interventions.
Terrific. And earlier you mentioned COVID and the decline in mammograms. People just don't want to go to the hospital or to get checked out. How has COVID affected people living with cancer?
Boy, COVID's obviously it's been a terrible year and a half to 2 years of this pandemic. It has affected cancer patients to a great degree. First of all, cancer patients are more at risk for severe disease from COVID. So this has been a big concern. That's because their immune systems are often impaired because of the treatments that we give them to treat the cancer. Secondly, COVID has led to people avoiding their usual screening tests. So colonoscopy rates are way down. Mammography rates are down to some extent as well. And we've shown that with some of our research programs here out in the community, especially in the rural areas in Vermont. Screening rates have really dropped. So that's a concern because in general, if we find cancer early, we have a much better chance of curing it. And so we don't want people to avoid screening. And if they've put off screening because of the pandemic, it's now time to talk to their doctor about whether to go back and get back on a screening regimen to make sure that if there are any abnormalities that we can address either before they become cancer or at an early stage, we want to do it then.
Right, because as you say, it's catching it early is really key. And the war on cancer started in 1971. It's been 50 years since the National Cancer Institute was started. Are we doing enough? Are we making progress? What's your report card?
Well, I think we're doing a tremendous amount. I think there was optimism in 1971 that we'd cure cancer in 10 years. That obviously has not happened. But we didn't know that much about cancer then. We thought cancer was really a singular disease, that maybe one treatment could be developed and cure everybody with cancer. And that's not at all the case. We now know that cancer is 100 different diseases, and that there are different genetic mutations. And that even though we target those genetic mutations, the cancer cells are very sneaky, and they can develop other mutations, and then we have to develop other therapies to treat that. So I think that we know a tremendous amount. We've developed some great therapies. Survival for cancer has really gone up. We have more and more cancer survivors across the country, here in Vermont and the rest of the country. And that's really a testament to new therapies that have been developed through laboratory research, population-based research, and then clinical trials that we've now brought to help people with cancer and reduce the cancer burden.
Very important. And to learn more about the UVM Cancer Center, check the website on your screen, vermontcancer.org. Through the website, you can also email Dr. Holcomb with any questions or let the center know if there's a cancer-related topic you'd like to see covered on a future Cancer Center program. Dr. Holcomb, thank you so much for being with us today, and we look forward to learning more from the UVM Cancer Center in the months ahead.
It's been a real pleasure. Thank you for having me here today, for being able to share some of this information about cancer. It's our passion here to address cancer for the people of Vermont and upstate New York, and I'm happy to be here. Thank you.
Awesome. Thank you so much, Dr. Holcomb. And thank you for joining us across the fence. I'm Fran Stoddard. Stay well.